Diffuse idiopathic skeletal hyperostosis is a bony hardening of ligaments in areas where they attach to your spine. Also known as Forestier's disease, this condition might not cause symptoms or require treatment. If it does cause symptoms, the most common are mild to moderate pain and stiffness in your upper back. Diffuse idiopathic skeletal hyperostosis can also affect your neck and lower back, and some people have this disease in other areas, such as shoulders, elbows, knees and heels. Diffuse idiopathic skeletal hyperostosis can be progressive. As it worsens, it can cause serious complications. You might have no signs or symptoms of diffuse idiopathic skeletal hyperostosis. For those who have signs and symptoms, the upper portion of the back is most commonly affected. Signs and symptoms might include stiffness, pain, loss of range of motion, and difficulty swallowing or a hoarse voice. Stiffness may be most noticeable in the morning. Pain. You might feel pain in your back or in other affected areas, such as your shoulder, elbow, knee or heel. Loss of range of motion. You might notice this most when stretching side to side. Difficulty swallowing or a hoarse voice. You might have these if you have diffuse idiopathic skeletal hyperostosis in your neck. Diffuse idiopathic skeletal hyperostosis is caused by the buildup of calcium salts in the ligaments and tendons and hardening and overgrowth of bone. But what causes these to occur is unknown. Doctors have some idea of what can increase your risk of the condition. Risk factors include sex, older age, diabetes, and other conditions and certain medications. Sex. Men are more likely to develop diffuse idiopathic skeletal hyperostosis. Older age. Diffuse idiopathic skeletal hyperostosis is most common in older adults, especially in people older than 50. Diabetes and other conditions. People with type 2 diabetes might be more likely to develop diffuse idiopathic skeletal hyperostosis than those who don't have diabetes. Other conditions that can raise insulin levels in your body may also increase your risk, including hyperinsulinemia, prediabetes and obesity. Certain medications. Long-term use of medications called retinoids, such as isotretinoin, amnestime, Clarivis or others, which are used to treat skin conditions such as acne, can increase your risk. People with diffuse idiopathic skeletal hyperostosis are at risk of certain complications, such as disability, difficulty swallowing and spinal fracture. Disability. Loss of range of motion in the affected joint can make it difficult to use that joint. For instance, diffuse idiopathic skeletal hyperostosis in your shoulder can make it difficult to use your arm. Difficulty swallowing. Bone spurs in the neck can put pressure on your esophagus. The pressure from bone spurs can also cause a hoarse voice or sleep apnea, a sleep disorder in which you stop breathing repeatedly during sleep. Rarely, this can become serious and might require surgery to remove the bone spurs. Spinal fracture. Diffuse idiopathic skeletal hyperostosis can increase your risk of breaking bones in your spine, especially if you have moderate to severe disease. Even minor injuries can cause fractures. Breaks might require surgery to repair. To determine whether you have diffuse idiopathic skeletal hyperostosis, your doctor might begin with a physical examination of your spine and joints. He or she will press lightly on your spine and joints to feel for abnormalities and check your range of motion. Your doctor will also order imaging tests, such as X-rays, CT scans or MRIs, to look for changes in your spine. While there's no cure for diffuse idiopathic skeletal hyperostosis, you can take steps to reduce pain and stiffness. Treatment is also aimed at keeping the condition from worsening and at preventing complications. Because of the relationship between diffuse idiopathic skeletal hyperostosis and conditions such as obesity, insulin resistance and type 2 diabetes, treating those conditions might slow or halt the progression of diffuse idiopathic skeletal hyperostosis. Your doctor might recommend over-the-counter pain relievers, such as acetaminophen, Tylenol or others, or ibuprofen, Advil, Motrin IB or others. More severe pain can be treated with corticosteroid injections. Physical therapy can reduce the stiffness associated with diffuse idiopathic skeletal hyperostosis. Exercises might also increase the range of motion in your joints. Ask your doctor about specific exercises you can do. He or she might refer you to a physical therapist for further guidance. Surgery might be needed in rare cases when diffuse idiopathic skeletal hyperostosis causes severe complications. People who have difficulty swallowing due to large bone spurs in the neck might need surgery to remove the bone spurs. Surgery might also relieve pressure on the spinal cord caused by diffuse idiopathic skeletal hyperostosis. To help you manage pain and stiffness and to halt progression of the disease, try these self-care measures. Exercise regularly. Regular aerobic exercise, such as walking or swimming, can increase your endurance, keep your body more nimble and help you cope with diffuse idiopathic skeletal hyperostosis. Talk with your doctor before starting an exercise program. Achieve and maintain a desirable weight. Since obesity is associated with diffuse idiopathic skeletal hyperostosis, losing weight might help keep the disease from progressing and lower your risk of complications. Apply heat. Use a heating pad on affected areas of your body to reduce pain. Set the heating pad to low to reduce the risk of burns.